Some of you may be concerned that this very public conversation we're having about suicide may in some way be part of the problem, that these kids are feeding off the attention of previous suicides. But a mental health advocate that I spoke to today says that could not be further from the truth. It's something he says he knows both from research as well as from his own life.
I'm 13. There's an 8-inch chef's knife in my backpack.
Mark Henick documents the depression he suffered as a teen.
I'm 17. I want to talk to my peers about my experience with mental illness.
A mental health advocate who can more than just relate to the Woodstock kids who thought the end was the answer.
I've been there, and that's why I'm so passionate about this. When I was a teenager, I had at least a half a dozen suicide attempts myself, each escalating closer and closer to the point of death, until eventually I found myself on the wrong side of a railing on a bridge late one night alone. When I had let go, somebody reached out and grabbed me and pulled me back. I can honestly say, looking back, that if I had told myself then that things would get better, I wouldn't have believed me either.
Suicide contagion, a cluster of deaths in a small community, is not a case of copycats, Mark says, but rather a trigger for those with underlying mental health problems.
It's like pulling off a Band-Aid. When somebody else does it, it provides a pathway. Triggering people isn't necessarily the problem. It's what we do after. If you're going to pull off that Band-Aid, you better be ready to stop the bleeding.
Are we able to stop the bleeding?
Unfortunately, I think in many respects we're not. We don't have the kind of healthcare system that really is designed to prevent suicide.
And here's the proof: the flood of kids who are now using ER hospitals as a last resort in this province.
We've seen a 60% increase in hospitalizations for kids with mental health disorders over the last decade.
That tells me that kids aren't getting help until almost it's too late.
Absolutely. We're waiting too long to treat these kids.
Right now, the average wait time in Ontario for a child needing mental health treatment is 1 long year, even for families like Kimberly's who know how to navigate the system.
When our daughter was 11 years old, she became sad. And we went to our family doctor and we looked for help, but there was wait times and wait lists for mental health services. We couldn't access the mental health professionals that we needed. And within a couple of months, we actually were in the hospital with a suicidal kid.
But Kim's daughter, like Mark, did get the help they need, and they're now flourishing.
Our depression, our anxiety, our mental illnesses lie to us, and they tell us that we have to die, and we don't have to. There's lots of people out there who have survived and who are thriving after this kind of tragedy.
We've talked more about suicide in recent years, and in fact in recent days, than probably ever before. The thinking used to be that talking about it made it happen. But Mark Henick, a mental health advocate, says talking about it actually saves lives. But he says it's the way we talk about it that's vitally important.
We know that there's a good way and a bad way to talk about suicide. The unhelpful, unconstructive way is to sensationalize it, to make it seem like it's a romantic, good option for that person, when suicide is never a good option. It's always a tragedy when that happens, and we can always prevent it. Suicide's a public health crisis. When we talk about things like copycat suicides, I think that actually devalues the severity of the situation, especially young people. They're not doing it. They're not engaging in suicide attempts or completing suicide because it's popular or because their friends are doing it. They're doing it because there's probably an underlying mental health problem that isn't being treated.
You said there's a right way to talk about suicide and the wrong way, and you talked about the wrong way. What is the conversation that we in the media, that we as parents, we as friends should be having on this day?
Well, we should be having conversations, period. I think one of the worst things that happens, whether it's in the media or especially in communities, is just to avoid talking about suicide for that reason, for the reason that we think it gives people the idea to go out and do it, or that it encourages suicide to talk about it. That's just not true. When people are thinking about suicide, and there's a lot more people who think about it than we realize, and there's a lot more people who think about it than just the numbers of those who die, but it's important to communicate to them that there is help out there, that how you feel in that moment isn't necessarily representative of reality. The most effective way to prevent suicide is to ask people directly, are you thinking about killing yourself? If they're not, then fine. But if they are, and they tell you, that gives us an opportunity to help.